In the United States, we spend over $326 billion on outpatient prescription drugs in 2016. And we know that the spending for prescription drugs has increased significantly over time. This can create affordability challenges for patients. In particular, for drugs used for cancer, HIV, multiple sclerosis, and other high-priced complex conditions, we know that patients may face substantial cost sharing. Cost sharing can be in several forms. Co-payments, co-insurance, and deductibles are the most common. Depending on a patient's insurance, they may have to pay a lot of money up front to fill their prescription drugs. As an example, plans offered through the Affordable Care Act now have deductibles that range from $4,000 to $6,000. Patients on Medicare Part D, the most common insurance for prescription drugs for older adults, would be expected to pay sometimes thousands of dollars up front to start specialty medications like those for cancer. How do we begin to address these issues? So there are a few policy solutions that we could consider. Some of these are to think about doing things like using flat copayment amounts instead of coinsurance for covering prescription drugs. Coinsurance is when a patient pays a percentage of their drug spending or the drug price when they're filling their drug. So as the drug price increases, so does the patient spending. Instead, if we used copayments or flat dollar amounts, it could provide more stability so that patients know what to expect when they go to the pharmacy counter to fill their drugs. We also need to think about capping out-of-pocket spending for Medicare beneficiaries. Right now, a Medicare beneficiary has to spend an unlimited amount of money when they're filling very expensive drugs. So even after they reach the catastrophic spending threshold, which is nearly $5,000, they still have to spend additional money each month to continue to fill their drugs and to be adherent. We should consider changing policies so that we cap that spending. And finally, we should think about ways that we could share money that is being received by the pharmaceutical benefits manager or the health insurance plan, and how that money could more directly benefit patients and be shared with them when they are spending money at the pharmacy counter. These are some possible solutions for addressing out-of-pocket spending for patients. These solutions don't address drug prices directly, which is an important factor and something we need to consider when trying to address drug spending in the U.S. So solutions really need to take into account both insurance benefit design and drug spending and prices.